Hello and welcome to this live demo of Aquarius EMR. My name is Corey and I'll be taking you through some of our features today. Aquarius EMR is the most user-friendly and customizable electronic medical record or electronic health record available. What we do is allow you to take your office and go completely paperless. What I'm going to do right now is just log in and get started on a little tour of our software. We offer electronic medical record. We are certified by the ONC and CHIT. We were in the first round of the certification. We were one of the original 22 certified in October of 2010, and so we do qualify you for the meaningful use reimbursements by the government. That is if you're billing in either Medicare or Medicaid, and we can send you some more information on that. For now, I'm going to take you through this demo of our functionality. So I guess what I'll do is kind of take you through what most people, how most people would use this software. Something to keep in mind as I go along is that everything is truly customizable to meet the flow of your practice. We're never going to tell you you have to do it our way. We're going to modify the flow so that we can do it your way. So typically a patient would walk in and the receptionist can go ahead and click on search for the patient by a variety of methods here, and I'm going to pull up just some of the names in the software we have on our demo unit here, and I guess what I'll do is I'll just go ahead and pull up Karen Smith. For some things to notice here at the bottom, we have our demographics here. This is part of meaningful use requirements, that we're storing all the demographics right in the system here. So all the patient's information, we have a few pages of that, the ethnicity and race, that's part of meaningful use here. We can also scan insurance cards and store that information directly in the software as well. However, with our practice management software, you won't need to worry about this because all the billing and insurance verification is done right there. So moving on, I'm going to go ahead and pull this patient's chart. For the purpose of this demo, I'm going to pull it for myself, but typically the receptionist will be pulling for whatever doctor is going to be seeing that patient. Then I can indicate for what, by color coding, whatever reason the patient's in for. I'm going to go ahead and pull the chart, and I'll go ahead and pull one other person just so you see how that looks in the next screen. Okay, I'm going to go ahead and close this search patient window, and now if I was the doctor who had the chart pulled for me, I would be able to open up my pull charts, and I can see all the people who are pulled here, and you can see the different colors depending on why they were pulled. So Karen Smith here, I can put her, she's already automatically placed in a room, or if I wanted to, I could simply place her in whatever room I prefer. And this layout on the right here, you see, is customized to look like the floor plan of your practice. So however it is, however many rooms you have, however the floor layout is, this will be customized for you. Another thing is that the nurse typically often sees the patient first to do the vitals, so the nurse would be able to log right in here and pull up Karen Smith's vitals. So what I can do is add a new column. And something else unique about our software that I haven't mentioned yet is that everything is touchscreen capable. So for example, on this screen, if I were to come up into the corner, I can go ahead and tap right into that box, blood pressure, and I get a nice big box that comes up here. So if I wanted to, I could mount this unit on the wall, for example. It's a nice big screen, and the nurse wouldn't even have to use a keyboard. She can just click on the patient, open up vitals, and go ahead and enter in the vital information. Another part of meaningful use is to track growth over time for patients, for children. So this, as you can see on the right here, growth charts are automatically plotted. The BMI is automatically calculated based off of the height and weight, so I can show you that here. You can see the BMI calculated. I'm going to leave all these blank for now, but it's also nice to point out that we can graph the vitals over time. We can look at flow sheets of different labs. In fact, I'll go ahead and open these up for you real fast so you get a quick look. I'm not sure how much data is inputted here over time, since this is just a demo unit. We'll look at a period of the last 2 years, and here you can see temperature. Of course, there's going to be some weird data depending on who's been using this computer, this system, I should say. But it's nice that you can see there's going to be little alerts if there's something you should be aware of. So moving on from here, I'll just show you the flow sheets. This is going to allow me to plot different lab results right into the system. I can input the data directly myself here, or if the lab centers you work with are capable for working electronically, then this data can be imported directly from the lab electronically. Moving on through the flow, let's get rid of that. So Karen Smith, if I'm the doctor and I can see which patients I have in my rooms, for example, the nurse would probably be the one putting the patients in different rooms. And so if I was the doctor, I could see, okay, I have Karen Smith here. Let's see how long she's been waiting. Okay, I want to open up that patient. So I'm going to go in the room and open up Karen Smith. And the first thing you're going to see when I open up Karen is that, well, I have an alert and reminder that I set for myself from the last time. Make sure I've completed that. Also, on the left, you're going to see the clinical summary of the patient, or the clinical history. So we have the active problems, inactive problems, we have surgeries, medications, test result history, allergies, social history, family history, physical and procedure history. And this is just a summary of everything that's been done for the patient since the start of the EMR system. So of course you're going to have your paper charts that have been with the full clinical history of the patient, but from the time you implement your EMR system, you're going to have a summary here of all the procedures that have been done. All the diagnosis codes, the ICD-9 codes from previous encounters are summarized for you here. We also have a solution, another module called TouchChart, that we integrated into our software, and what that's going to do is allow you to see the entire paper history of your patients. So what we do for you is we completely digitize your charts, so you have an electronic chart that looks and feels exactly like your physical charts, and you can go through page by page just like you normally would. It can also store x-rays or other types of files, MRIs, whatever kind of videos or sound files you might have. So it's very cool, and I'll show you that in just a few minutes here. But for now, I'm going to go through and show you how our encounter actually works when we open up a brand new encounter. On the right here, you can see I can follow up on the last encounter, or I can create a new empty encounter. And we have built-in templates for a variety of specialties, as you can see here. So looking through these specialties, what we can do is actually, even though this is built in, before we ever come into your office and have you go live, as soon as you decide you're going with Aquarius EMR, what we're going to do is actually create a customized template for you. And that's what I really love about this software, is that from the very beginning we're going to customize every little detail to make sure that it's going to fit your flow, and the questions in the template are going to be the questions you normally ask your patient. So for now, keep that in mind, and I'm going to explain in a minute here how that will all tie in together. But as soon as I open up a new template, the first thing you can see is an empty encounter summary here on the right. Immediately you get a date and time stamp of when the encounter began, and conveniently you have a clock here that's going to keep track of how long you're with your patients for your own use. On this side on the left is the empty encounter. I chose internal medicine. And something to keep in mind as we go through this is that every single field on this entire template is going to be easily modified. You can add new fields to it, you can change the choices, and as I go through the encounter, you're also going to see the right side blinking from time to time. What that's doing is it's refreshing I can also manually refresh here, but it's going to refresh all the information I'm inputting in the template and bring it over. So already you can see the vitals that were entered are calculated here on the right. So moving on with the encounter. Well, before I do that, something our software does is keeps track of all of the interactions with drugs and allergies. So it's going to show me, warning doctor, nitroglycerin or Viagra, there's a interaction there, and etc. So I can just ignore that for now. But it's nice to know that, even if I'm going to prescribe something new, it'll warn me at the time I'm prescribing, like, are you sure you want to do that because this patient's too young for that kind of medication, etc. So I'll just take you through and kind of show you how this all fills out. So when I click on chief complaint here, it gives me a list of chief complaints that whoever this template was made for, these are the chief complaints they wanted. If these aren't the ones you would be using, that's okay, because we can easily modify this, and we're going to teach you how to do it yourself, because you can do this on the fly. For now, I'm going to click abdominal pain, and it's going to automatically put it in there for me. If I was with a patient and I didn't see what I wanted to here, I could easily type in whatever I wanted up here, or I could drag and dictate right into this box, or if I had a stylus and a laptop, I could handwrite and it would detect my handwriting and place that text right inside this box. So I'm never tied down to any one method of inputting data, but what I recommend all doctors do is input all of their typical choices in this box, so that when they're with a patient, they can simply move through the encounters as quickly as possible just with a simple click. So pain scale, 7. Quality, some doctors might like these. You don't have to put anything in. You can skip over them. Duration of symptoms, it was 5 days. Intermediate. The onset was 2 weeks ago. Reason for visit, this is an initial visit. It's associated bloating. Patient denies blood and stools, etc. So what I can do now, I'm going to just tell it to refresh. So the cool thing is, just from these few little clicks that I've now inputted this information, on the right it's extracting all this information over here, and it's creating the narrative for me on the fly. So Karen Smith is a 46-year-old female. The reason for her visit is initial visit and complains of abdominal pain since 2 weeks ago. Her symptoms are associated to bloating, etc. So what you can see here is the narrative being created as I'm inputting the information. Now the cool thing is that this is, again, everything is completely customizable. So if you don't like the language here, if you say, oh, that's not really how I would say it, Corey, can you change that for me? No problem. We can go in and change any of the data exactly the way you want it to sound. As simply as going in and changing a few of the words. It's extracting this information from the patient's demographics, so that regardless of which patient I open up, the information is always going to be accurate. So that's something nice to know that we can create, and we're going to create this for you and teach you how to change it later if you want to add or modify any of it. Now before I move on, I also, while I'm on the topic of modifying this and customizing it, I wanted to just show you how you actually would add choices to this list here. So if I see these choices and I'm saying, you know what, every time I see a new patient, I end up typing in what's something that's not on this list, foot pain. I keep typing in foot pain, and it's really something that I just want to have on this list. So I'm going to show you that I can just go in and modify list. I can type foot pain right here, and if I wanted to type something else, like super foot pain, I'm no doctor, so I'm gonna go ahead and just put that in. I think I used this before for back pain, so accept, and I can now click in here and I see foot pain, so I can go ahead and click foot pain, and now every time from this point forward, when I save this template, it shows me template modified in this corner here. So I can go ahead and save the template, and from this point forward, anytime I see a new patient using internal medicine template, it's going to have that as an option for me. So it's nice to know that I can always be adding and enhancing my template as I see my patients. If there's a field I wanted to add a new field, I can easily insert a new one. If I want it to be, let's say, I'll just put extra because I don't know what you would like it to be. Go ahead and insert that, and then I can start creating a new question for my patients, which I can incorporate over here into my narrative. The example I had before, quality, if I can add more choices here, or if you're a doctor, you say, oh, I don't really ask that question, I can go ahead and just remove that from the template. I can cut and paste items, I can move them around. It's all up to you. And again, I can't emphasize this enough. As soon as I come into the office, I'm going to create this for you. I'm going to figure out what it is you like, what is your flow, what kind of questions do you ask, what kind of options do you like to have, what do you go through with your patient. I'm going to make sure the order of all these items are exactly how you'd like it to be. And then I'm going to teach you how to do it yourself. And just from watching me now, I'm sure you get that it's very simple to modify these if I ever wanted to. So no worries there. You're always going to be able to have your template serving you in the exact way you'd like it to. Going through the SOAP notes here, I'm just going to briefly go over the different fields. Here, the first time I'm with a patient after I implement my EMR system, I'm going to want to go over the past medical history, different active problems, inactive, input the allergies. Having these allergies and active medications, for example, these are all part of meeting the meaningful use requirements. Preventative care and disease management, this is something I really like about our software, is we can go in and open that up, and it's going to give me a list of all of the items that this patient has been flagged for. And our software comes preloaded with all the possible immunizations, for example, or if it's something that you typically would not be seeing in your office, we can go in the database and remove those for you so you don't have to deal with them. But it's nice to know that you have the option of being flagged for different items that will pertain to your patients. Moving on, active medications. You can go in and have a list of all of your patients' active medications. You can easily prescribe more. You can change the dosages, formulations, etc. And I'll show you in a couple minutes how to add new prescriptions or e-prescribe as well. Smoking history and habits, this is also part of meaningful use. I believe it's 40 or 50% of all your patients must have you must have the smoking status on file, for example. Moving on, surgical history, family history, social history, review of systems. Down here we have the general exam. Something neat about our software as well, we can, rather than have you having to go through and click each item, you can actually have pre-clicks. So right here I have the general, the normal items checked. In fact, I think there should be even a couple here. I'm no doctor, but I think a few of these should be clicked as well, typically. But the idea is that we can go through and create what a typical normal exam would look like, and then if you see anything abnormal, you can go ahead and uncheck the items that are related to your patient. Something else to look at is that we have the capability of having images stored for each of these items. So and it comes preloaded, and I'll show you here one for Karen Smith, for example. It's preloaded with images, so this is what we have for heart. I can show that there's a blockage somewhere if I wanted to. Put a little arrow, if I circle, put text in. It's up to you. It's all customizable for whatever you'd like to use it for. We can also import new images if you don't like the ones we have, and teach you how to do that yourself. Another example here, abdomen, for example. I can, if there's sharp abdomen pain, I can circle a region and say this is where the pain is. Just click on one more. If you have any chiropractors who want to point out different vertebrae, for example. And I'll just go ahead and move on to the assessment in the SOAP notes. So, and also anytime if you wanted to move between sections, you can do that here, and it's going to allow you to shortcut between the different sections. If you are using a touch screen, that makes it easier than wanting to scroll for some people. So in the assessment section, the cool thing about this is, well, there's a few ways you can do it. The first thing I'm going to do when I come into your office and start customizing a solution for you is I'm going to look at your super bill and what kind of common ICD-9 codes do you use. Then I can create the virtual version of that a few different ways. I can create different categories and have checkboxes for you, which is similar to how it would be on your super bill, only this is better because it gives you the option of listing everything you could possibly want rather than everything you can fit on a single piece of paper. And if I ever wanted to add something, for example, I can easily insert an item, and it's going to pull up my ICD-9 database with all the codes. Another thing is that our software automatically updates the databases for you, so when ICD-10 comes out shortly, you're going to not have to worry about it. It's going to automatically go into the software and update that for you. I can go through this and start looking at codes, and right away you can notice there's different colors attached to different codes, which is great because it's going to tell you which codes are billable or non-billable. So of course I can't just pick 140 and expect to get paid by that and bill that. I'm going to have to choose the most specific modifier for whatever it is I'm diagnosing and then treating. So 140.0, that's a billable code. That's more specific. I'm sure you're familiar with that. I can also search up here, knee for example. Again, I can never just put 717. I would have to be the most specific. If I try to, it's going to warn me. Warning, you have selected an unbillable code. The health plan might reject the claim. So it's nice to know I'm never going to be dealing with codes where I'm not getting reimbursed. And you'd be surprised at the number of doctors I see. I look at their super bill, I go into the software, and then I notice that these codes are not very specific and they're missing out on a lot of money. So right away we're going to eliminate that for you. Another way you can do this instead of the checkboxes is just have a box here, a diagnostic box. So we can have all of your frequently diagnosed codes here. We can have a list of all the codes that you want to see regularly, and then again, if I want to add codes to this list, I go in and I can insert them. What some doctors prefer is to have different boxes. For example, I can go in and copy and paste these. I can change the names. Maybe you want to have diagnosis 1 and then diagnosis 2, etc. And you can have this look any way you prefer, whatever is easiest for you. And to actually, let's go ahead and choose a code as I go through the encounter. Then there's the plan. This can look however you'd like it to as well. We can go into suggested handouts, which is built into our software. We have a full database of handouts which are related to a variety of illnesses and demographics. So for this particular patient, Karen Smith, we can see different handouts which may or may not be related. The idea is that we can program the handouts to show up for different patients. So however you'd like them to be programmed, we can do that for you. Moving on to my prescription, this is going to allow me to write a prescription for my patient. So I can look at all the medications my current patient is on or the ones I frequently prescribe. I can go in, for example, and decide that I want to prescribe this one. Go ahead and check it, and it's going to pull that information over here and fill it out for me. So I can easily change my typical formulation and prescribe it to my patient. But for now I'm going to cancel that and show you, I guess while I'm on prescription, I'll point out at the top here we have something called Quick Prescribe and E-Prescribe. Quick Prescribe is very similar to what you just saw. If I click that, it's going to pull up a list of my frequently prescribed medications, or the ones that this patient is currently taking. I can look at the frequent ones here. So if I wanted to prescribe something to this patient, I simply check the box, click OK, and I'm done. And at the end of the encounter I can print that off, or have the people at the front print it off and I can sign it. Whatever it is you prefer for your flow. The other thing is e-prescribe. Now, just doing your prescription electronically is great because it's going to eliminate having to buy the pads, etc. But really what you want to do is e-prescribe, and that's part of meeting the meaningful use requirements for EMR and EHR. So here, this is not currently linked to any pharmacies, but if it was, I'd be able to have my prescription in here, and I would select the pharmacy from a drop-down list that my patient goes to, and it would send this prescription electronically to that pharmacy. And then simply by clicking sign, I'm done. I'm all set. The patient now gets to go and pick up their prescription. So that's great. Moving down through the encounter, I'll go to orders. The order section, this is specifically for the procedures that you're not doing in your office. So if I need to order something outside the office, I can do that here. The databases for each of these types of items, for example x-rays, is built right in, just like all the other databases. It's going to show me all the different x-rays here that I can select or do a search for. The cool thing here is that, so you can continue to do what you're currently doing. I can check for example, an MRI in the abdomen, and then that can get sent to the front desk and they can order it for the patient, or however you're currently doing it. Although if your lab center is equipped to accept electronic information, then we can go ahead and send this directly to the lab center without anything further, and that's going to save you a lot of time in your practice to be able to do that. Moving on down here, we can see the current procedure terms. So I know a lot of doctors like to bill based on how long the patient's in the room and what kind of procedures are being done. I can go ahead and just pick 20 minutes here. Then I can go down. So currently this is all that's listed here, but when I come into your office and I see your super bill, I'm going to create, just like I did with the assessment and with the ICD-9 codes, I'm going to go through all your CPT codes and figure out what kind of procedures are you doing in your office, and I'm going to create a list for you. So is it injections, is it an EKG, whatever it may be, we can go ahead and insert those items for you. For example, just to show you, you can easily go ahead and pick this, insert that item, and it would be here. But we can do it by category, we can do it by list box as you saw earlier, whatever it is you prefer. Let's remove that. Okay, so here I'll go ahead and say massage and any other recommendations. If I have any referrals, if I have any referrals, I can go ahead and insert those as well. So now that I've reached the end of the encounter, I'm going to go up and sign it to complete it. So what it's going to do is pull up a summary of what was done. It's going to ask me to select a follow-up time. So let's say 2 weeks. If I had different facilities, it would ask me to select those here. I can see the order I've placed here. I can have any reminders that are going to show up anytime this patient's open. So when the receptionist at the front desk gets this patient to check out, she's going to see that there's a reminder to give a referral. which can be done electronically. There's notes here, so I can, say, be sure to collect copay. I might want to put that in the reminder, make it nice and big for the receptionist. And then I can send to a variety of people in my office. I'm going to send it to myself again, just so I don't have to log out and log back in. And I'm going to sign and finalize the encounter. By entering my password here, I am giving my electronic signature, and now right away you're going to see that this is signed by the administrator, the clock has stopped, and I have a summary of what was done in that encounter. I can always go back and see it at any time. I can look at all my previous encounters here. I can there's a few other things you can do. For example, if a patient is going to the checkout counter, but then he comes running back and says, "Oh, doctor, forgot to mention I have this pain in my left knee. I was wondering if you could check it out." I know that happens for a lot of doctors just about on a daily basis. That's no problem. You can always go in and add an addendum. You can, let's say you decided you realized there was something you missed, or you messed up on, or you checked the wrong box, and you're thinking, oh, what do I do now? So all you have to do is go in. You can revise or make an amendment. You can always view your amendments from the past if there was anything you had to change, and it's going to actually display the original and the amended version. So you're always protected against audits. No one's going to think you're involved in any kind of fraud, because we keep the original for you and highlight the changes you made, and you get to explain why you made those changes. I accidentally checked the wrong box. No big deal. So that's great that you have all those options for you. Before I go ahead and close this patient, what I want to do is actually show you our TouchChart functionality here. So up to this point, everything you've seen is great because you've been able to see how we go through a flow of the EMR. So really from today forward, from the day you get your EMR implemented in your office and you go live, you're going to be able to input all of your data right into the system and have it all stored for you. But what about all the paper files from the past, all of your backlog? I walk into doctors' offices and I see walls of files, and all the time that's spent going searching for files, for lost files, or even just pulling a file that's in its right place, that all takes time. And what we've done is created a solution for doctors to have a virtual chart. I'm going to go ahead and open that up here. This is TouchChart at the top. And because I'm in Karen Smith's file, as soon as I click TouchChart, it's going to go ahead and open up Karen Smith's electronic chart. And right here on the left, I can see these tabs. You can have more tabs if you prefer. Whatever it is that you are currently using as organization in your physical chart, we're going to customize for you in this digital chart. You can also have sub-tabs within tabs, whatever it is you prefer, really. So I can go, I'm not sure what information is stored in here, but I can go in and see, if this was filled out. Of course, it would be on here too. I think we've just scanned in a few examples of what you might want to put into TouchChart. I can easily touch the screen and drag my finger and get a nice big version for me to see. Medications, again, can easily scan through here, reading anything just as easily as I would if it was actually paper, if not easier. Can go through the labs. I can go through different documents. And really what sets this software apart from other scanning softwares for converting paper to electronic is two things. One is that we're going to create a chart, as I said, that's matching your physical chart. The other great thing about this is that, and what we were hearing from doctors, I should say, is that the feedback we were getting from the field is that regardless of what EMR doctors had, they were finding it impossible to scan all of their charts in and then finding the charts, because it came up with a long document list and they had to scan page by page. having different file names for each page that was scanned in, or possibly even worse, having one file name for all of their pages and having to go through and find anything was impossible. So what we have done is created a way that you can actually scan your chart section by section. So regardless of how long your chart is, if it's 200 pages, no problem. You can go in and just put in little dividers, which you actually saw here a minute ago. This barcode at the top, we print those off for each section. So for patient info, we'll print off a barcode and just stick that in the first section. Then labs, then whatever it is, medications, we're going to go in and just put those little dividers in and take all of those papers from your paper chart and drop it into the scanner, which is now going to scan it into the system at 40 pages a minute, double-sided. And now you'll have it automatically sorting each section to the exact place it's supposed to go that you'd like it to be. So right here, as soon as the scanner saw this barcode, it knew that section belonged in patient info. The same thing goes for these others, and you can choose to remove these pages or keep them in. Whoever did this kept this one in there. Typically I would have those removed before it enters the TouchChart, but it's nice that we kept it so I could show it to you. Additionally, you can also, maybe I can find one in here, some people choose to place barcodes like labels onto the pages themselves rather than dividers. So you can have a little label printer sitting right next to your computer. When you want to scan something in to TouchChart, all you do is print a little label, stick it on the page, drop it in the scanner, and it goes right where it's supposed to go. So it's very convenient. We're finding it's saving doctors at least 75% of the pain they were going through to put in all of their paper charts into their EMR systems. So regardless of whether or not you decide on Aquarius EMR today, if you like what you see, you don't like what you see, it's also nice to point out that we can always integrate TouchChart for you regardless of your EMR system. So we can create a script that will pull up, maybe we probably won't put a button like this nice in your EMR, but maybe having you press F10, for example, on your keyboard will then pull up Karen Smith's TouchChart, and we can go ahead and integrate that into whatever EMR system you choose. Let me just go ahead and exit Karen Smith here, and I wanted to show you, I've already removed Karen Smith, but let me pull her back out. So typically the receptionist would have Karen Smith in here, and she would see the check mark because the doctor has closed that patient or signed the encounter. So as the receptionist now looking at the pull charts, I can take Karen Smith and go ahead and check her out. It's going to show me that alert and reminder again. I can see the order name, when I should schedule my follow-up, and I can collect the copay and go ahead and close the patient. In the case of the practice management software, if you were to purchase that from us, this information would get sent directly over to the practice management, and you would handle all the scheduling and billing from there. So for the purposes of our EMR, all I'm going to do is click close, remove the patient from the pull charts, and let's make sure she's not in that room anymore. Okay, then we're all set. And that about summarizes our flow of our EMR software, Aquarius EMR. Before we finish up here, what I want to quickly do is also show you something I haven't yet mentioned called our Meaningful Use Dashboard. We have an entire module integrated with our software for reporting, as you can see here. And when I open that up, it's going to show me, I have the option here of tracking all of my meaningful use requirements. So this is something I haven't really seen in any other EMR, is something this simple to use and really graphical interface. So up here we see Meaningful Use Dashboard. I can go in here. Let's look at, by year. Let's look at all of 2011, and it's going to show me all of the meaningful use requirements in a graphical form. And so I can say, okay, this is one I'm not meeting, electronic orders. So what is that? Then I can click on the question mark here. It's going to explain to me exactly what I should be doing. I have to have more than 30% of my patients with at least one medication, listing by the EP or admitted to the eligible hospitals, etc. So basically I need to e-prescribe at least 30% is what they're saying here. And this is great because I can go in at any time, or I guess this is e-prescribe here. Well, shows how much I know about meaningful use requirements. This is the lab centers. So this is sending items directly to the lab center electronically, as I mentioned earlier. So in e-prescribing, as you can see here, you need 40% of your prescriptions written and transmitted electronically using our EHR. Smoking status. If your patient's at least age 13 or older, you're going to want to track at least 50% of your patients in that section I showed you in our template, whether or not they're a smoker, not smoking, etc. So you can see these flags that are red here showing I'm not actually meeting that requirement for my patients. Down here, oh, this one's green, so that's great. I can say, yeah, I met the requirement, more than 10% of all unique patients seen. So that's pretty simple to meet. I can go down here. Just by purchasing our EMR software, you're already fulfilling 8 of the meaningful use requirements. So it's good to know that just by using the software, you're already fulfilling 8 of those requirements. And to summarize again for you, there's 15 core requirements that are required, and there's an additional 10 of which you have to fulfill 5. So you really have a menu of 10, and you get to choose 5 of them. But we make it very easy for you to fulfill all the requirements right here. Of course, our software is doing drug-drug and drug allergy interaction checks, as you saw. So that's automatically being fulfilled. You have the privacy and security, etc. So I hope you will find this useful after you purchase the software and are able to get the meaningful use reimbursements. This makes it very easy for you to be able to print reports, for example, and keep track of and submit to the government exactly what it is you're doing right. And that about summarizes our demo here. I hope you enjoyed what you saw, and if you have any questions at all, you can feel free to contact the sales rep that sent you to this video, or check out our website at aquariusimaging.net. Thank you and have a wonderful day.